Well, thank you everyone for joining us this morning. My name is Lauren Purvis and I am a program manager for the Child Wellness team here at the Center for Children's Health. So again, thank you for joining us for the 5th Healthy Children Coalition for Parker County. Please be aware that this session will be recorded and made available through website and social media links to inform and educate the public on this topic. At the end of today's summit, we will have a facilitated discussion with our Center for Children's Health team, and then you'll be invited to unmute yourself to ask questions, or you can type your question in the chat box. Keep in mind that if you choose to participate in an identifiable way, you acknowledge that your image and or name will be recorded and are authorizing the use of your information in the recording as described. You have no obligation to appear or speak in the recording, and you can turn off your video and participate under a different name should you wish to remain anonymous. The recording of today's summit is protected by copyright law and is not to be copied. And if you feel comfortable doing so, please turn on your video at this time. Before we get started, I'd like to thank our elected officials for joining us today. We have Judge Dean on the call, so welcome Judge Dean. Is there anybody else on the call? Great. Well, we are honored to have you here with us today. I'm just going to go over our agenda before we get started. Becky Hale, the Director of the Child Health Evaluation Team for the Center for Children's Health, will kick us off with the Cook Children's Commitment. Then the Honorable Pat Dean will provide our formal welcome. After that, we will hear about Cook Children's efforts to improve children's health in the region. And then we'll receive an overview of the Healthy Children Coalition for Parker County to learn how we're improving children's health locally. And then the highlight of the day will be learning about the results of our most recent community health needs assessment and how Parker County children are doing in the following topics: healthy lifestyles, mental health, and parenting support. After the data presentation, we'll take a short break before the award presentation. And after the presentation, there will be a 15-minute facilitated discussion, and we'll finish up the day with a call to action and closing remarks. With that, I'd like to introduce Dr. Becky Hale. Becky serves as Director of Child Health Evaluation in the Center for Children's Health. Her team oversees the research aspect of our community health needs assessment, evaluation efforts for the programs and coalitions led by the center, and various reporting endeavors to both internal and external audiences. Becky has worked for Cook Children's for a little over 10 years and recently completed her doctorate in education, with her research identifying the overlap of community-based strategies addressing tooth decay, obesity, and asthma among children and families.
Thank you, Lauren, and thank you all for joining us this morning. Cook Children's is committed to serving the children and families in our communities, and we're excited to bring you results from our most recent Community Health Needs Assessment today. And this needs assessment is one of the many ways that we fulfill our system's promise, which is knowing that every child's life is sacred. It is the promise of Cook Children's to improve the health of every child through the prevention and treatment of illness, disease, and injury. In light of today's events and our needs assessment, I'd like to thank the leadership of the Center for Children's Health, Chris Pedigo and Marilyn Napier. And I'd also like to recognize the work of the Child Health Evaluation team in overseeing the needs assessment research process, as well as Courtney Bernard, Lauren Purvis, and Dora Garcia in the planning and coordination of our summit today. So at this time, I will turn it over to Dora, who will continue with our agenda.
Thank you, Becky. I'm Dora Garcia, Program Coordinator for the Healthy Children Coalition for Parker County. Our first speaker, the Honorable Pat Dean, was elected in 2018 as Parker County Judge. Judge Dean is a former corporate executive, mayor of Hudson Oaks, and baseball coach. His previous contributions as mayor have been instrumental in bringing both small and large businesses to Hudson Oaks, including H-E-B, John Deere, Starbucks, Chick-fil-A, McDonald's, and NextLink. Judge Dean's private sector roles include managing the hearing aid business in both the U.S. and Canada for Duracell, before being promoted to Global EMO Manager over the Midwest, Asia, and Europe. Judge Dean has received numerous awards in the corporate sector, including the President's Award for Expanding Global Markets. His executive leadership roles have led to multiple and successful launches in growing Duracell's global strategic business to over 15% market share. This experience has been instrumental in bringing a performance-based initiative and cost savings to Parker County. Judge Dean currently serves on the East Parker County Chamber, Weatherford Chamber, Springtown Chamber, Aledo Rotary Club, Springtown Optimist Club, Regional Transport Council, 911 Board, Juvenile Board, and Local Government Collaborative. He has previously served on the Parker County United Way, American Red Cross, and Weatherford Little League boards. Judge Dean and his wife, Kathy, have lived in Parker County since October of 1992. They're celebrating 37 years of marriage this year. They have 4 children ranging from ages 17 to 31. Kathy is a realtor at Lynch Legacy in Willow Park. Judge Dean holds a BBA from Texas Wesleyan University in Economics and Finance, an MBA from the University of Phoenix, Dallas in Global Management. They live in Hudson Oak and are members of Lakeshore Drive Baptist Church. Welcome, Judge Dean, and thank you for being here.
Thank you, and I'm sorry that I had help with a lot of that. That really does embellish a lot. It's a privilege to be here, and thank you for the second time to address you. And fortunately, it was before when it was pre-COVID. We did it in person, and I thank you for allowing me to do this through a Zoom hearing. This is near and dear to me, and just to kind of touch on my own thoughts here before I go through some of this. One of the things I want to add to this at the end is going to be very, while the numbers are actually quite, in looking at these with Parker County, the numbers are positive, but clearly there's room for improvement. And it's something that I want to address just as we conclude this on my part. But this journey began back in 2009 when Cook Children's conducted an assessment of children's health in Parker County. In 2011, community members across Parker County came together and created the Health Children Coalition for Parker County to focus on improving the health and well-being of children in the county. From the CHNA, results, stakeholders identified healthy lifestyles and the primary health focus for the coalition. And this clearly has had an impact on our county, because some of these numbers, while they really have need for improvement, it does show that there is an awareness with this, and much more than maybe the last time that I did this. And the concern is how do we implement this and how do we proceed forward? One of the key things is educating and encouraging our community to have healthier lifestyles and providing resources. And this is not an easy thing to do. It's something that we get into an adjustment of way of life that even myself, in racing from a meeting to meeting, you tend to just grab a burger, or you for your family as well. Or if you go into a baseball game that I coach, chances are Ethan, and I'm going to tell him myself here, is probably going to grab a Whataburger or something. But the outreach programs and collaboration in talking about what the objectives are of this, and the collaboration from our schools, which we need desperately, churches, healthcare providers, community leaders, which is very important because we have a lot of those here in Parker County, not to mention elected officials as well. And the only way we can accomplish this is because doing it together and being a team together. It has to be that way. And I can't go out and throw it on the website and go out and tout this or have town hall meetings and talk about this program without it embedding into the community and living this and getting this out to the community and living it every day. It has to be a part of our life to make this thing work. MedPods is something, I don't know if you've heard of this. It's a collaboration with the Parker County Hospital District and the ISDs, where we put equipment into the schools, which immediately diagnoses illness, which allowed us to achieve a 98% in-classroom rate for our schools last year. The mental programs, which Cynthia is on here, County Relations Officer, has been a part of on Joy, just for the Cook Children's Hospital, And I'm going to read some just quickly this, just breath and also, and I'm sorry, I'm having to read this, but that program has been something that has been near and dear, I know, to Cynthia. T-Chat, which is a counselor assistant for children's in crisis. It's something that has been real critical in driving these numbers down, I think impacting these numbers. And in looking at these numbers, I don't have what they were 3 years ago, but it does show that there is an impact. There is an awareness already with this program, which we can actually step back and give ourselves a hand for that, because we're not starting from ground zero. As I said earlier, it was 2011 that this was started. So we have a great deal of momentum. The question is now, how do we continue this and how do we further impact and embed ourselves into the community with this awareness program? And one of the key things I want to talk about as I conclude my part of this is the mental health aspect of this, because we're coming out of which is it's a new normal now. And so with COVID now winding down, but it's still a part of who we are, and we still have to be aware of that. While we don't promote mass, we allow the personal freedoms and personal choices of the families, we still have to deal with that. It does impact this program. So it's a different dynamic now that you're dealing with than was before because of the COVID situation. And even though it is at a point now where we're going back, getting our lives back together again, you're having to deal with that, which then brings in the mental illness aspect, which has a severe need here in the county, a lot, not even that, but across the state. So I do magistrate at the jail. I do probates, guardianships, mental competencies. I see these numbers. And that is a very critical thing for us. One of the things I'd like to conclude with, I really want to thank the people that are on here that are very dedicated, because it is you who have made this program successful in Parker County and brought it to us. And you have my commitment that I'm going to continue to push this through our community, through these people, through the community leaders, elected officials, the hospital, the healthcare providers, and so forth, where we can make this something and further embed this to get these numbers even better than what they are today. And again, I want to thank you for the opportunity to speak. I could go on, but you're not here to hear me talk all day. But it is near and dear to my heart, and you have my full commitment to make this program work in Parker County. And thank you very much.
Thank you, Judge Dean. And Becky will join us again to lead us into the data presentation.
If I may, for one brief moment, I'm going to have to take a break for just about 15 minutes, but I will be back. And so if you see my screen go dark, I will only be gone for a few minutes.
Thank you.
Thank you.
All right. Thank you, Dora. And thank you, Judge Dean. I appreciate him sharing such a great overview of all the efforts going on in Parker County. And as he highlighted, community collaboration is key. And it sounds like there's so much of that happening in Parker County. As we begin the data presentation, I'd like to highlight what a collaborative process our assessment has been this time around. So just like Judge Dean mentioned, the importance of community collaboration, we also took a collaborative approach this time around with collecting our data, and you all played a really important part in that as well. So I'd like to highlight that first, and then I'll share a little bit more about the assessment methodology, and then Blair Williams will share a little bit more about the data results themselves, particularly for Parker County. Next slide, please. All right, so I'd like to first recognize our numerous supportive community and research partners. I'd first like to thank you all for attending today, and I know many of you helped share information about our parent survey with the families in Parker County. And then also you completed the community leader survey, and some of you participated in an interview. So thank you for your support in this endeavor. I'd also like to thank Linda Fulmer, our CHNA administrator, and a big thank you to our research vendors who provided their expertise, ETC Institute, MHMR of Tarrant County, UNT Health Science Center School of Public Health, and the Center for Transforming Lives. I'd also like to recognize the many internal departments within Cook Children's who have been very supportive of our 2021 Community Health Needs Assessment. And those departments are listed there on the screen. And then also for this assessment, we brought together an external advisory committee made up of community partners representing the 8 counties within our service area. These partners met July 2020 through August of 2021, and they shared their time and insight with us as we were finalizing our parent and community leader surveys. They also created awareness of the surveys during data collection, and some provided interviews. We had representation from all 8 counties on this committee, and I'd like to especially thank Lexi Lee and Kenny Kofer for representing Parker County on this committee. We greatly appreciate their involvement and their support. Next slide, please. All right, so we expanded our methodology for our 2021 Community Health Needs Assessment. We conducted a household survey of parents and caregivers of children 0 to 17 from all 8 counties within our service area. And it's really important to note that this parent caregiver survey provides us with information from the parent's perspective, which is really insightful, but it's also one piece of the puzzle. So for that reason, we used a few other methods of data as well. We held face-to-face interviews with families experiencing homelessness or with an undocumented member. We held virtual focus groups with families to gain a deeper layer of understanding around the barriers to access to care, COVID-19, and prevention topics. We conducted a community leader survey and then visited with more than 20 leaders for a more in-depth conversation around children's health issues in their community. And then finally, we reviewed local, state, and national data to kind of fill in any gaps, look at trends or benchmarks, or provide additional insights. And so at this time, I'd like to play a short video that just kind of recaps a little bit more about the methodology.
Maintaining good health for North Texas families is not always easy. Many families face obstacles such as poverty, discrimination, quality education, housing, and unsafe environments. Addressing these hurdles requires a community-wide approach with a shared goal: healthy children. Everything we do at Cook Children stems from the promise we've made to our communities to improve the health of every child through the prevention and treatment of illness, disease, and injury. One way we keep this promise is through our Community Health Needs Assessment. Every 3 years through this assessment, we hear from parents and community leaders throughout North Texas. The valuable data revealed in this assessment becomes a shared rallying cry for community partners who collaborate with us to prevent illness and injury to children. The Center for Children's Health leads the Community Health Needs Assessment research and outreach services for Cook Children's. The center works to prevent injuries and illness and improves access to services for asthma, child abuse and neglect prevention, healthy lifestyles, injury prevention, mental health, oral health, and parenting support. A key element within our Community Health Needs Assessment is the Community-Wide Children's Health Assessment and Planning Survey. This is a household survey of parents and caregivers of children newborn to 17 to assess their perspective about children's health across our communities. The survey asks questions about how various health issues affect their children and how easy or difficult it is to obtain medical care. We want to know the parents' perspective on children's health. This survey, available in English and Spanish, is administered to parents and caregivers through mail, phone, and email. Because we care about the perspective of all parents within our region, we send the survey to a random sample of 25,000 households within our 8-county service area. We also intentionally survey families experiencing homelessness and families with at least one undocumented member. We're able to survey enough parents to have a high level of confidence in our survey results. Parents and caregivers in each county also participate in virtual focus groups to give us a deeper layer of data. These focus groups allow us to further learn about the unique challenges parents face with accessing medical care and social services within our communities. In addition to the parent and caregiver perspective, we survey and interview leaders throughout the community regarding their views on children's health. Additional children's health data from national, state, and local public health and academic sources supplement the findings from parent and community leader surveys. We bring all this data together to share with communities across our region. Together with community partners, we work through our various collaborations to determine the best avenues to address these complex issues. It takes all of us working together to clear a path to better health for all children in our communities.
Right, so we collected quite a bit of information this time around, and we'd love to share additional details of our methodology efforts for those who would like to know more. So for this reason, we have created 9 separate FAQ type documents that outline many additional details of how we conducted our research. And we'll place a link in the chat to our website where these documents can be downloaded if you are interested. And then you may also reach out at any time through the email address chnafeedback@cookchildrens.org if you'd like to know more in the future. I also wanted to share that while we've conducted our parent survey, which is also known as CHAPS, since 2009, we knew that due to COVID-19 and other variables that it was time to update our survey a little to better align our questions with the National Survey of Children's Health. And this really helps us compare our results to the national and state results. And Blair will provide some of that later in the CHNA data presentation. And we not only better aligned our parent survey questions to the National Survey of Children's Health, but we expanded our survey from households with children 0 to 14 to 0 to 17 this time around to really help capture more information around the health needs of the teen population. Next slide. And then we also included 2 additional counties. So we're now surveying an 8-county region. We added Collin and Grayson. And because of these enhancements to our process this time around, it means that we just want to be mindful when we might compare data to previous survey years. And we can still do comparisons on some questions, but because of the additional data that we've collected this time around with the focus groups and interviews, we aren't necessarily focusing as much on the previous survey year's results today, but we do recognize that this work is complex and we know that progress is being made daily. Our parent caregiver survey methodology included oversampling in counties with the lower populations and then weighting the results by zip code to ensure geographic distribution of the survey sample, and so that it's comparable and representative to the actual child population, both at the 8-county level and then at the individual county level as well. So the parent survey data was expanded to match 2021 census estimates for the 1.2 million children under age 18 living in our 8-county service area with regard to age, race, income, Hispanic ancestry, and gender. And we completed our target of 471 surveys in Parker County. Next slide, please. And then I'll share a little bit more about our community leader survey demographics. So this particular survey is not necessarily representative of the population, but we did collect a very strong sample of 306 community leaders across the 8 counties. And leaders selected one primary county in terms of answering the survey. And a little over 7% of the respondents selected Parker as their primary county. We also asked what role they are involved in within their community. And they're allowed to select more than one role in the survey. The top 3 roles were the categories of health professional, social services nonprofit, and educator school official. And Blair will share a little bit more about these results in just a few minutes in the presentation. Next slide. Okay, so after Blair shares the results, Lauren will provide a final wrap up of our data presentation. And before she begins, I would like to share a little bit more about Blair. Blair Williams is a child health evaluation analyst at Cook Children's Center for Children's Health. For the past 15 years, her expertise and passion for public health has been focused on child and family health. In previous roles, she served as a community health educator, advisor to healthcare and school administrators, developer of family-centered community wellness programs, and researcher for family wellness behaviors. Blair brings her experience, enthusiasm, and love for data to our community health needs assessment. She loves supporting Cook Children's and community stakeholders so we can all bring joy and improved health to every child. Take it away, Blair.
Thank you, Becky, and good morning, everybody. It is such an honor to be here and to be able to share Parker County's results with you. So in the next couple of minutes, I will be going over some of the highlights of what we found for Parker County children ages 0 to 17. And while I'm looking at some of the CHAPS data in this presentation, I'm also supplementing it with some of that qualitative data that Becky mentioned in her presentation. So today's presentation is titled Help for Children and Families, and today we're focusing on Parker County children. Next slide. Okay, so we're all here today with the same question in mind, and that's how do we help every child with their health needs? And in our 8 county service area, as Becky mentioned, we have a population of over 1.2 million children ages 0 to 17. And so that's a diverse population, diverse needs, and then you layer on this COVID pandemic and all the other health needs that children have. So we're all here today with that in mind, and that was one of the reasons why we expanded that methodology in our CHNA to include children up to 17 and to improve it with some of that qualitative data so that way we had really great context in what we were seeing in our parent survey. Next slide. So in this presentation, Becky mentioned some of the methodology that we used in our CHNA report. In this presentation, I'll focus on that survey of caregivers with children, and you'll hear me use the term parent and caregiver throughout the presentation. And we delivered this survey to caregivers of children 0 to 17, recognizing that it may not be about biological parent that's providing care for a child. It may be a grandparent, it may be an aunt, uncle, step parent. So we recognize that there's a diversity in child caregiver type as well. So I'll use that term caregiver and parent interchangeably throughout this presentation, but it does mean the same. So we're focusing on those results for this presentation. And again, it's a representative sample of Parker County children. So we're able then to estimate how many or what percentage of children in Parker County may have that specific health need. And we're focused on health, education, learning, environment, and parenting in today's section. We also did a face-to-face survey of over 200 underserved caregivers, and that represents children that were experiencing homelessness at the time of the survey or had at least one undocumented family member at the time of survey. Over 300 community leaders across the 8 county service area. And as Becky mentioned, it's not representative at the county level. So anytime I present data around the caregivers, or the community leader survey, that's referring to the 8 county area, not specifically Parker County. We also had interviews of over 25 community leaders across the 8 county service area and conducted focus groups, 6 focus groups across our 8 county service area and conducted 1 interview. And so I'll pull some of those quotes from those leader interviews and the focus group in this presentation, but to protect the privacy and to respect the participants who were grateful and thankful enough, we're thankful of their time. We did not provide any identifying information in this presentation. So you don't know what county they're from and you don't know any identifying information. And then we also supplement all that with secondary data throughout the presentation, and in our CHNA report, you'll see so much more. But for the purpose of today's presentation, we're looking at the US Census data, National Survey of Children's Health, which Becky had mentioned. National Survey of Children's Health is conducted annually, and it's a way of the nation understanding what our health needs are across the nation and at the state level. And again, that survey is done for children of 0 to 17 as well. And the most recent data was made available for 2020. So we do have some pandemic level data at the national and state level. And also supplementing that with some of the data that we get from CDC and other types of sources. Next slide. So when we did our CHNA assessment, we identified the following community health needs: oral health, mental health, healthy lifestyles, parenting and family support, injury prevention, asthma, overall health, and equitable access to care. So these are ongoing from what we had identified in previous CHNAs. But what we did this time in our CHNA report of our 8-county service area is really recognize how social determinants of health plays a role in all of these topics and how all of these topics are connected. In other words, they're not siloed. So family support plays a large role in healthy lifestyles, plays a large role in mental health. And so that's something that you'll see throughout this presentation. Next slide. And if you're not familiar with the term social determinants of health, it's a term that's most often used in regards to public health, where we see that where children or families live ultimately determines their health outcomes. And for children, specifically, where they live, learn, and play impacts their health. And that could be their immediate health, but also their health as they become adults. Next slide. So we come back to this question, and how do we help every child with their health needs? And in Parker County, of course, we're going to focus on Parker County today. There's over 36,000 children that are ages 0 to 17 in Parker County. So we'll focus on that, and we'll provide some population estimates for you. And hopefully this will help you with your work. And if you can go to the next slide, there we go. This is the HELP acronym. So if you know me, there's a lot of things that I love. I love puns, I love acronyms, and I love data. So I'm hoping to bring all 3 of those things to you today, in addition to this powerful data. But this HELP acronym is a way of organizing all of our findings in a way that helps you digest it and be able to use it in your own work. So it also helps us frame up the community health needs, any equity gaps that we've identified, and again, that information on healthy lifestyles. So we look at health, that's that first section, that's equitable access to care and basic needs. Then environment, that's safety where children live, learn, and play. Learning, readiness, and support for academic success. And parenting, that's parent and family support. So all of our data will fall into these 4 categories. And as I present it, you'll see how these all intersect. So again, this is a high-level presentation of what we see in Parker County. It has simple stats and stories and efforts to support your work. Some of this may be data that you already know. Some of it may just be a way of validating, or some of it might be new and maybe give you some ideas on what you can do in the community. Again, this is not everything, and there's just so much more. And I wish I could just give you all of the data today in our time together. But I do encourage you to review those FAQ documents that Becky mentioned. When our CHNA report, the full report, comes out, you'll see so many gems in there that could be really useful to your work. Also, our data dashboard is a new offering this year, where you could go onto our C4CH website, and there's instructions on how to access our data dashboard. And you could look at all of our 8-county data through all of the parent survey findings and do crosstabs even. So you could look at Parker County data on that data dashboard. And again, if you had any questions about today's presentation or any of the data or anything else, you can always reach us at chnafeedback@cookchildrens.org. Next slide. All right, so here we are. We're starting with our first section, and this is the health section. And that's focusing on equitable access to care and basic needs. And all of this data is pulled mainly from our parent survey. Again, that's children 0 to 17. And all of the data is based on parent perception. So this is what parents and caregivers are telling us about their child's health. Next slide. Okay, so first we'll look at health status. So we'll see how children in Parker County are with their health status. And on our parent survey, and this is a question that aligns with the national survey, so we could see how Parker County, our 8-county, aligns with the state and national estimates, there's a question where they have 5 options of how they can define their child's health. And here we're looking at the percentage of children that have excellent or very good health according to their caregiver. So as we can see, according to caregivers of children 0 to 17 in Parker County, most children have ideal health. That's 8 and 10 children. Now, for those 2 and 10 children, we'll look at those kinds of estimates and connect those pieces in the other slides. But we could see that most children in Parker County are healthy. And this rate is similar to what we see at the local rate, which is our 8-county service area. And it is slightly lower than what we see at the US and Texas benchmarks before and during the pandemic. If we were to look at that 2 and 10 children, that's about 4,500 children that don't have ideal health status. So 4,500 children that may need health services to help improve their health. And when we look at that 2 and 10 children, we see that the ideal health status rate is lowest in our 12 to 17 age group. So our adolescent teenager age group in Parker County. And we also see it being the lowest among Hispanic children in Parker County. Now, there's many factors that can contribute to this. Pandemic, limited access to healthcare, limited access to basic needs like food and housing, all those social determinants, those could be impacting it. Some other factors to consider is that if we look at Parker County children, 10% did not receive a well child preventive visit in the past year. And that may be in part due to the pandemic and some of the offices were closed, or it may just be that this 10% of children didn't have access to receive that. And we also see that 10% did not receive all needed medical care in the past year. So that could also impact their health. Next slide. In this slide, we're looking at oral health status of Parker County children. Again, it's that same definition of ideal health status. Here, though, we're looking at children ages 1 to 17 because by 1, they have teeth, and so the parent can provide an estimate on the status of their child's teeth. So in Parker County, most children have excellent or very good oral health. That's 7 to 10 children. This rate is similar to what we see at the 8-county service area, but it is lower than the US and Texas benchmarks. And that's similar to what we see at the 8-county level. In Parker County, there's over 9,000 children that are ages 1 to 17 that don't have that ideal oral health status. And we see that those rates are lowest in children ages 6 to 17, that's school-age children. Also, they're lowest among Black children. When we look at school-age children and their oral health, we see that 8% of school-age children in Parker County have missed school because of dental pain. And 7% did not receive all preventive dental care, and 13% did not receive all needed dental care. And the main reasons why caregivers told us their child did not receive all needed dental care was that many of the offices were closed in the early stages of the pandemic. And they were concerned about the pandemic and just safety as the pandemic went on. But it's also a cost barrier for some and transportation barrier for some. But when we look at all the different types of healthcare that have been foregone across our 8-county service area, dental care is the most neglected type of healthcare that the child does not receive. Next slide. Okay, so our next slide, we're looking at BMI. And for our data here, we calculated BMI based on what parents gave us for their child's height, weight, and gender. And we followed CDC BMI for age calculation. And you're probably wondering why we only have ages 10 to 17 on here. So this is a best practice when you're collecting data from parents in a survey. And it's also followed up the National Survey for Children's Health that the estimates that parents provide for child height and weight are more accurate at ages 10 and up. So we could calculate BMI for age for younger children, but we have higher confidence or accuracy in looking at BMI for age for children 10 to 17 on parent survey. So if we look at children 10 to 17 in Parker County, 6 and 10 have a normal BMI for age. And that's based on 4 classifications. That's underweight, normal weight, overweight, or obese. And if we combine overweight and obese, we see that 1/3 of Parker County children ages 10 to 17 are considered overweight or obese, and 6% are underweight. Now, all of these rates are similar to what we see at the 8-county level and also at the national and state level before and during the pandemic. So consistent with what we see across the board. Over 6,000 children ages 10 to 17 don't have that normal BMI. And if we look at the children that do have that overweight or obese BMI classification, they're less likely to have the ideal health status that we've seen in the previous slide. They're less likely to have the ideal oral health status that we saw in the previous slide. And they're less likely to receive all of their needed medical care. So not saying that the BMI is a predictor of their access to health, but social determinants of health could be playing a large role in what we're seeing here. Next slide. Now, if we look at some other factors that can impact overall health and healthy lifestyles and BMI, we look at the number of children who received all needed care. And in Parker County, 1 in 4 children did not receive all needed care for their health, dental, or mental services in the past year. That's an estimated 9,500 children. This is about the same rate that we see at our 8-county level, but same to our 8-county level, these rates are much higher than what we see at the national and state level. So our local rate and Parker County rate of children who did not receive all needed care is higher than what we're seeing at the national and state level. And we had a follow-up question on the survey for caregivers to tell us why they did not receive all of the needed care for their child. And the top reasons that parents told us were that the insurance was not sufficient to cover costs. COVID pandemic limited their access to the doctor's office, and services weren't available in their area. And we saw that more frequently with more outlying counties, so that urban or mostly urban rural counties. So just transportation to get to their appointments could also be a limiting factor. Next slide. And when we talked about insurance on the previous slide, we'll look at our insurance rates here in Parker County. So of children ages 0 to 17, based on what parents told us on this survey, 1 in 10 children did not have continuous health insurance in the past year. That's an estimated 3,600 children. Now, when I say continuous, that means without any gaps in coverage. They had insurance every month of the year. So while most children have insurance in Parker County, if we look at the reason why children did not, parents told us that they had dropped coverage because it was unaffordable, or they had a change in employment, or they dropped their coverage because it was inadequate. So these could be influenced by the pandemic because we saw job loss, we saw disruption in everybody's life because of the pandemic. But one of the facts or stats that kind of stood out to me was that Parker County had the highest rate compared to all the counties of children that had dropped coverage because it was unaffordable. So when I think about that in terms of healthy lifestyles, what does that mean in terms of their access to healthcare? What does that mean in terms of their access to opportunities for physical activity or nutrition? Next slide. So let's supplement everything we just heard on our caregiver survey with what we heard from our focus groups and our community leaders. And we heard that there are many families that have to drive 40 miles plus to get to their provider or find a provider that accepts their insurance. And so for families that have the means to do that, that's helpful. But for some families, they don't have the transportation. Others have to miss work or school in order to make that commute. And we even had a comment from a parent at a focus group that said that the nurse and front office lady have made comments about how much school their child's missed because of all these medical appointments. And in other parent interviews, we heard that sometimes the parents have to commute with multiple children in order to make good use of their time. So that would mean even though one child doesn't have an appointment, they would still have to miss school because brother or sister had an appointment. And then another reason why families may not be receiving, or children may not be receiving all of their needed care, is for children that are underserved. Either they're undocumented or they're homeless, or a parent has a concern. They're fearful of seeking help because they could be reported or deported, or they're just concerned because there's a language barrier. So if there's any kinds of barriers like that, that may limit the children from getting all of the health care they need. And so we think about all that data and what we're hearing from parents and community leaders, we clearly see that social determinants of health are impacting the access to healthcare for children. Next slide. And so if we continue with this social determinants of health theme, we take a look at what our community leaders told us on their survey. Mind you, this is over 300 community leaders from the 8-county service area. So this is not specific to Parker County, but it's something that we heard from our leaders on survey and also from community leader interviews that we had. On our leader survey, over 60% of leaders felt that poverty and affordable housing were serious problems for children in their community. And this may be in part due to COVID. However, the feedback we got from interviews was that there is a very clear distinction in some communities between the haves and the have-nots. So there may be children that have everything and all the protective factors, where there may be children that don't. And for some, if housing is unavailable, especially for low-income families, if there's not a lot of low-income housing available, it becomes very competitive or the wait list is long. If you're middle income, you don't qualify for low-income housing, and it may be difficult with what's in inventory to find affordable housing. And then for higher income, of course, there's just a competitive housing market. So we see that housing has played a role in child health and their access to health and even their safety. And even one community leader pointed out that housing affects everything, child health, their access to health, and in some cases, we'll explore this more in the next section, but their learning as well. Next section. Awesome, thank you. So we'll take that kind of poverty lens and kind of look at what we saw for Parker County children by income. And so we asked on the caregiver survey if they could provide their income. And we had 8 different categories. And for the purpose of today's presentation, just to make it simple, we condense it down. So we're looking at 4 different categories of income here. We have below $50,000 a year, $50,000 to $100,000 a year, $100,000 to $150,000, and then 150 plus. And the median household income, according to census in Parker County, is 98,000. And so for this, we'll just look at children under 100,000. And in our sample size, 3 in 5 children in Parker County live in a household that has an annual family income below 100,000. That's an estimated number of 19,000 children. When we look at all of those health stats that we've just talked about by income, we see that children who live in household incomes below 100,000 are less likely to have that ideal health status, the ideal oral health status, a normal BMI for age, access to nutritious foods, having continuous insurance without any gaps in coverage, or to receive all of their needed care. So clearly, the income plays a role in their child's access to healthcare and all those basic needs that children require. Next slide. And what we saw here when we took that income lens, it was supported by what we heard from our community leaders and our parents during those qualitative interviews. We saw that child health and well-being is impacted by limited access to basic needs, food, housing, and healthcare. And we also saw that access to nutritious foods, physical activity, and family support plays a role in maintaining those healthy lifestyles of children. So of course, COVID played a role in disrupting food access for some children. In some ways, it exacerbated needs for food in some areas. But we did hear from community leaders that parents are forced to choose And that might be the case with insurance, and why we see so many had to drop it because it was unaffordable. Others may not have access to get to the grocery store to get those fresh fruits and vegetables that they need. And another parent comment that I think connects with every topic we're about to discuss is there's a parent that said, so we can tell people all day long that they need to have their kids in outdoor activities. But if they're working 2 jobs, they can't afford to take them to the park every day, and they can't afford to put them in activities. So if nutrition's lacking and they're not getting physical activity, it creates a snowball effect. And so I love that quote because it really just ties together everything we just talked about, that social determinants of health, the role of how important it is to promote healthy lifestyles, but also support families so that they can maintain that healthy lifestyle for children. Next slide. So to sum up the health section of our HELP acronym, we see that social determinants of health clearly influences health, equitable access to health and basic needs, and healthy lifestyles as well. And when we look at our secondary data and just an understanding of this data and our community health needs, we see that children, in order to achieve health and that equitable access to care, need preventive care and treatment when needed. And they need basic needs met for safe housing, stable housing, and also food, nutritious foods to promote overall health and well-being. And while I presented a lot of needs here in this health section, it's important to point out that the pandemic also brought out a lot of good in the community. And there was a lot of people who came together, recognized a need, and helped get food to kids in need, helped parents with jobs or any kind of income support. So there was quite a bit of great that came from the COVID pandemic in response to the needs we've seen. Next slide. For our next section of our HELP acronym, we're looking at environment, and that's safety where children live, learn, and play. And in this section, again, this is all parent provided data. We're looking at ER visits due to accidental injury. We're looking at first childhood experiences, otherwise known as ACEs. And we're also looking at neighborhood and school safety of Parker County children. Next slide. So first we'll look at accidental injury for Parker County children ages 0 to 17. And this is based on what parents have told us. And from that stat, we see that nearly 1 in 6 children in Parker County received emergency care for an accidental injury. Now, while that's over 5,000 children, I'd like to point out that 2 things must happen here in order for the stat to be given to you. 1, child was injured, and 2, child received emergency care. What this doesn't tell us is how many children were injured, and there may have been children that needed emergency care or needed care but did not receive it. So this stat just lets us know how many children were injured and received emergency care for their injury. And so if we take a step back and look at injury at the national and state level, we're looking at leading causes of unintentional injury death for children under children 0 to 17. And we see that for infants, we see mainly deaths associated with suffocation due to unsafe sleep environments. For children ages 1 to 4, that's drowning. And then for children 5 to 17, motor vehicle traffic accidents. And in a way, these are all preventable. And what I'd like to also bring back is that that unstable housing and the role it plays for safe sleep environments for children, because we also heard from community leaders that crowded housing might lead to unsafe sleep environments for babies, where they're sharing beds with siblings or other adults. So the importance of making sure that children have safe sleep environments, either a crib or knowing to put that child to sleep correctly. And also the importance of providing water safety lessons, life jackets if they're around water to help prevent drowning incidents. And for motor vehicle traffic accidents, making sure that children have the proper car seat and are buckled every time they are in a car. So when we talk to parents about injury prevention, they have this kind of, well, it happens attitude, whereas our community leaders are saying, oh, we need car seats out there. We need life jackets out there. We need all this stuff out there. So the leaders see the connection between preventing it and the resources that help, but some parents just need a greater awareness on how they can provide that level of injury prevention in the home environment. Next slide. So if we look at injury prevention, if we look at safety from a different lens and we're looking at what happens in the home, there's a metric that we'll look at together, and that's our adverse childhood experiences. And if you've never heard of ACEs before, it's basically an event that happens to a child that could be potentially traumatic. It occurs in a child's life, and it could have immediate effects to that child or long-lasting health impacts. And so this question aligns, it's actually a series of questions that align with the National Survey of Children's Health. So we're able to see how Parker County and local children compare with ACEs to the national and state level. And it's a series of questions that we ask parents to complete. And if we look at this, we could say children have 0 ACEs, they have 1 ACE, or they have 2 to 8 ACEs. Here we're looking at children that have 2 or more ACEs. That would mean that they have a higher concern. They've had more traumatic experiences compared to their peers. And in Parker County, 1 in 8 children has 2 or more of those adverse childhood experiences. That's 4,600 children. They're listed below. You could see what all of those different adverse childhood experiences are, and they're ranked in order of what we heard from parents as being the most common. So parent or guardian divorced or separated, followed by living with anyone that was mentally ill, suicidal, or depressed, or had a problem with drugs and alcohol. And those 2 ACEs that I just mentioned were the top concern for community leaders on their interview. We asked the same kind of question about what they were concerned of children in their community. And children who had a parent that was mentally ill, or anyone in the house, or using drugs or alcohol, could be very traumatic for children living in those homes. We also saw that parent or guardian serving time in jail was a top ACE in Parker County. And I think back to what Judge Jean was saying in his opening remarks too, of how that all connects and what he's probably seeing with families there. And so if we look at this data and we compare it to what we see at the US and state level, we see that this rate of children with 2 or more ACEs is lower than what we saw at the national and state level. One of the things that we kept hearing again and again in our focus groups and our interviews was that the COVID pandemic itself should be considered an ACE because it was so disruptive to everybody's way of life, and we were socially distanced for a while. But the other concern we heard is that children who have these ACEs, or because of COVID, it exacerbated ACEs, or there was just a lot more stress in the home. It all tied together, and as a result, children may be engaging in risk behavior, substance abuse, or it also ties into their mental health. So another reason why that's important is that they could be showing up to the learning environment and acting out in the classroom, and that could signify that there's something going on in the home, traumatic or stressing to the child. And all that will connect more with our family support section. Next slide. So if we look at safety through the income lens, now we're just looking at the children who live in households below 50K. We see that those children in Parker County have the greatest safety needs. They're 3 times more likely to have 2 or more ACEs compared to their peers. They're less likely to feel safe in their neighborhood or school. And parents of children, infants, were less likely to place their baby to sleep in their own crib. So that connects again with that social determinants of health and how that involves and impacts safety. And again, that crowded housing piece, not only does it play a role in a child's overall health and well-being, but it plays a large role in their safety in terms of injury prevention and if they could be experiencing any adverse childhood experiences. Next slide. So to wrap up the environment section, we see that social determinants of health clearly has an influence on where children live, learn, and play. And we also see from our findings and best practices and secondary data that equitable access to emergency care and injury prevention resources helps children maintain that safety piece. Also, access to safe, stable housing and food and parenting support. And again, another positive quote from what we heard from our parents and community leaders, this one's a community leader quote, is that they had recognized that during COVID, there'd probably be an increase in case volume at the CACs, those child advocacy centers. And so they responded in full force. And there was such a great community collaboration around trying to help children with their safety and help families with their needs. Next slide. So for our learning section, again, this is our L in our health acronym. We're looking at learning, and that's readiness and support for academic success. So here we'll look at a couple different metrics. They're age filtered because of the type of question and what we're trying to report. So we'll go through and we'll start first with school readiness. So if you can go to the next slide. Thank you. Okay, so we're looking at children ages 3 to 5 in Parker County, and we're looking at their readiness to learn, their readiness to go to school. Again, this is based on parent provided information. So their readiness may be different, but this is what we've heard from parents, that nearly 60% of children ages 3 to 5 in Parker County are developmentally ready for school based on their growth and skills. So we have over 60 or nearly 60% that are ready to go to school and learn. Now, this rate is lower than what we see at the national and state level. And in part, that could be due to COVID, because children didn't have the opportunity to interact with their peers or get the structured learning environment of being in the classroom or preschool or even daycare. But that was a concern that we heard from parents and community leaders, is that the COVID pandemic largely impacted child's developmental milestones. Next slide. So next we'll look at children ages 3 to 17. And so this type of question, we're looking at developmental or learning disability based on what caregivers told us that they were told by a healthcare provider or an educator. So in Parker County, 1 in 10 children ages 3 to 17 has a developmental delay, and 1 in 7 children has a learning disability. Again, this is based on what parents provide us. And when we talk to parents about this on their focus group or community leaders, we heard that understanding where child development should be is not something that parents have a great awareness of. And if they had that greater awareness, they might know what to do or to seek care or guidance on what to do. Whereas community leaders said it'd be great to have some more of that resource available out in the community or even screening opportunities. So that connects again to social determinants of health and access to care. Next slide. And another key thing that Judge Dean had mentioned in his opening remarks was mental health and the importance of mental health and how it played a role during the COVID pandemic, of course. And so this metric, we're looking at diagnosed mental health conditions based on what caregivers have told us for school-age children, ages 6 to 17. And we look at the 4 most common mental health diagnoses. So that's anxiety, ADHD, ADD, depression, and behavioral or conduct problems. And according to caregivers of children ages 6 to 17 in Parker County, 36% of school-age children have at least one of those 4 conditions that I had mentioned. So this is slightly higher, just slightly higher than what we see at the 8-county level. But compared to what we see at the local rate, these diagnoses are higher than what we see at the national and state level before the pandemic. So on the right, you can see the graph there of how Parker County during the pandemic compares to the state and national pre-pandemic rates. And we could see that school-age children in Parker County far exceed what we see at the national and state level. So I'd like to point out this is based on what caregivers tell us who are diagnosed. There could be children out there that have undiagnosed mental health conditions, and we're not able to report that here. That's the case. Next slide. And so if we take this healthy lifestyles lens and look at this kind of mental health piece, we saw that school-age children with at least one of those 4 most common mental health diagnoses that I just mentioned were less likely to follow wellness recommendations. that eating the fresh fruits and vegetables every day, the 2 hours or less of entertainment screen time, 1 hour of physical activity every day, and 8 hours of sleep every day. And I'd like to also call out here that this connects with what we heard from community leader interviews, that just the overwhelming number of children who are engaged in social media and screen time, not only are they sedentary while they're doing that, but just being on screen time that long not only impacts their mental health, but it impacts their overall health. There's a lot more cyberbullying, concerns about internet safety. And another leader had pointed this all out and also connected to if there's outside or physical activity opportunities available in the community, that would help limit that high amount of physical activity, or excuse me, screen time. And also I pointed this out here in this slide, is that the World Health Organization fully recognized the gaming disorder as one of a formal disease, because children are spending so much time playing video games or on screens that they are suffering mental health effects, or they're not physically active as they should be. Next slide. So if we pull all of this together, we see clearly again that social determinants of health plays a large role in learning for children. That could be their access to developmental screenings, or some of the behavioral health concerns that they have for children or their families. But this all, again, pandemic, adverse childhood experiences, social determinants of health, those all play a large role in a child's learning. And from what we heard from community leaders and just what we're seeing in the community, we have seen a higher rate of teen suicide, and just the importance of preventing and just providing awareness around youth suicide. Cook Children's even responded with the Joy campaign to help bring resources and suicide prevention to the community. But another piece to show is that sometimes kids don't show depression or concerns about their mental health like adults do. And so they maybe come into the classroom, again, acting out or irritable, and that could signify that there's either an undiagnosed mental health condition, or there could be ACEs in the child's home environment. Next slide. Okay, so we see social determinants of health, all that swirling together here, and from our best practices that we could see from secondary data, again, that equitable access to developmental screenings and mental health services, access to safe, stable housing and food, parenting and family support, and again, resources not only for a child, but for the family on how to cope, be resilient, and even suicide prevention. All are helpful opportunities for a child's learning. And what we heard, another positive quote from community leaders, is they had recognized all these needs and how it impacts a child's learning. So they actually employed social workers throughout their campuses to help children with their basic needs, or to help families, especially during a pandemic when it was so disruptive to everybody's living and daily routine. So while they were finding out what these needs were, they actually uncovered some additional resources that were helpful to other children. Next slide. All right, so our final section of the HELP acronym, we're focused on parenting and family support in this section. We'll take a look at caregiver coping with parenting demands, having a source of emotional support to help with parenting, access to nutritious food and physical activity, and also a BMI for age. And again, as a reminder, when I use the word parent and caregiver, they're one and the same, and that could be a biological parent, a step parent, a grandparent, aunt, uncle, et cetera, et cetera. Next slide. Okay. So the first metric that we'll take a look at is our parent coping in Parker County. So this was a Likert question with 4 different options. And here we're looking at the number or estimate of children who have a caregiver that's coping very well with parenting demands. And similar to what we saw at the local level, our 8 county, we see that nearly half of children have a caregiver who is not coping very well with parenting demands. That's an estimated 17,000 children. Now, if we take a look at this Parker County rate and our 8 county rate and compare that to the national and state, we see that parents are not coping well as a whole. And we've actually seen at the national, state, and local level that trend has been decreasing. So we see that parent coping has been coming down over the past couple of years. That could be for many reasons. But one of the things I wanted to dig into is look at that healthy lifestyles based on this type of question. And if we think back to that parent quote where if a parent doesn't have the opportunity because they're working 2 jobs or transportation is difficult, how does that play a role in child physical activity and nutrition? So if the parents are coping very well, we saw that children who are older actually don't have parents that are coping very well. Parent coping was lowest in children that were overweight or obese. Parent coping was lower in children that had excessive screen time, meaning they had more than 2 hours every day. And the parent coping very well rate was lower among caregivers that were separated, widowed, never married, or divorced. So they didn't have an additional support. And it's a lot to take on during the COVID pandemic as being a single caregiver. Again, that just connects at social determinants of health and how that plays a role in everything else. Next slide. So if we look next at emotional support, 1 in 8 children have a caregiver that does not have an emotional support to help with parenting. But if we take a look at the parents that did have emotional support, the common sources that they received that support were from a family member or close friend, a spouse or domestic partner, a place of worship or religious leader, healthcare provider, or peer support group. These are all listed here as a reminder of protective factors and how this could tie into healthy lifestyles as well, because these are all opportunities for families to seek support from the community partners. And what we heard from parents was there are families that don't have emotional support, and so they're finding it in church groups, and that's their only source of support. Single parents are exhausted and their kids need a lot of attention, and they don't know what to do. And then if you add the financial stress or emotional stress of parenting, that makes it really difficult to provide for the family. Next slide. So if we take a look at social determinants of health and how that influences family wellness overall, we see of children ages 0 to 17 in Parker that 1 in 4 children live in households that can't always afford nutritious meals. So they can't always afford nutritious meals. That's fresh fruits, vegetables, and the like. That's an estimated 8,500 children in Parker County. We also see that 1 in 6 live in areas without nearby sidewalks, parks, rec centers, or grocery stores. So if they have limited transportation, that can make it difficult to go seek out physical activity, or they may have it, they just don't know about it. They may not know that that resource is available to them. We also see that 9 in 10 children in Parker County are getting too much entertainment screen time. They're getting more than 2 hours a day. That's over 30,000 children. Now, part of that could be due to COVID pandemic and being stuck at home and not being able to do as much, or it could be that they're excessive screen time users. And if we take a look at just children that have that overweight or obese BMI classification, we see that they're less likely to have those physical activity assets, meaning parks, rec centers, sidewalks. They're less likely to meet the recommendation for daily physical activity, less likely to have access to nutritious foods or eat fruits and vegetables. They're more likely to exceed their entertainment screen time, and they're more likely to have 2 or more ACEs. I let you marinate on that for a minute and see that this social determinants of health theme is very present for children that are in this classification. Next slide. So if we take a look at how parent awareness of resources plays a role in family wellness, we see that nearly 40% of children have a caregiver who is not very familiar with healthcare or dental services in their community. That's 40% of children who may not receive all the care they need or know of all the resources that are available to them to help with their overall well-being and their oral health. And over 70% of children have a caregiver who's not familiar with mental health services or 211 hotline available. So if a child has a mental health need, 70% of children have a caregiver who doesn't know where to start, right? And then 211 is a helpful resource that can help families get connected with food or additional resources available in the community if they're in need. This other stat that's on here just points out how important it is for children to receive preventive care, because 60% of children ages 1 to 5 who have a caregiver that they didn't know that they should take their child to the dentist at age 1. So if they don't know they should take their child to the dentist, then they're not going to go until there's a problem, which is probably why we saw the ideal oral health status lower in our school age children. Again, just the importance of parent support, family support, and awareness of community resources and preventive health. Next slide. So to sum up the kind of parenting section, again, we see this connection between access to care, basic needs, emotional support, those protective assets in the community for physical activity, nutrition. Those all provide a protective factor if those are all present. And for children that had parents that lost a job because of COVID, or parents were stressed, not only could that be a potential source of adverse childhood experience, for the child, but it could lead a child into risk behavior, substance abuse. And if physical activity opportunities aren't available in the community, then there's not that protective factor to prevent that child from involving themselves in risk behaviors. Next slide. So to conclude the parenting section, we see social determinants of health very present in parenting and family support. And we recognize the awareness of parenting and family support resources. So access to care, physical activity, healthy food, and also making sure that they receive preventive care, not only for their overall health, but for dental care, and also being able to talk with a healthcare provider around nutrition and different support services that they may need. And then that connects with what we heard from community leader interviews, was that there were so many organizations coming together to help children with unique health needs because of COVID, that they did uncover so much more and were able to help so much more families because they recognized there were so much more resources available in their community. So again, that social determinants of health piece is very present in all of this parenting section. Next slide. Okay, so our last and final slide together. I covered so much that I could in our time together. I hope that the HELP acronym is helpful to you, and that you are able to connect how healthy lifestyles plays a role in all of these categories, and how social determinants of health and all of these topics are connected. Again, it's very top level data, and I do encourage you, if you're interested and want to know more, to review our CHNA report when it comes available, or visit our website and check out our data dashboard, where you can engage with that data at the county level, and check out those FAQ documents that Becky had mentioned in her presentation. So thank you for spending your morning with me and hearing all about the Parker County data. And I am so thankful for your time and look forward to hearing what the discussion has in store for us.
All right, thank you, Blair. You always do such a good job of making all of the data easily digestible. I don't know how you do it, but I'm sure everyone appreciates it. But we've been so excited to share all of this information with you all, and so I hope Blair's been able to give you some new or validating insights to think about. And so I'd like to quickly recap a few key points from Blair's presentation. So in health needs for children in Parker County, we really need to look at preventive health care for health education and community resources, and those social supports to support children's health and well-being. And then those environmental needs, so safe and stable and nurturing environments to reduce the risk of physical or emotional harm. And then looking at children's learning needs, so again, that preventive care, developmental screenings, behavioral health, and those social services to support academic success. And then to support families and parents, looking at the social determinants of health, such as access to basic needs and healthcare or safety, with that social and emotional support for families. And so Blair mentioned this before she turned it over to me, but we'll have an interactive dialogue where we can discuss this data and how to help children and families in Parker County. And so Before we go on a break, I'd like to just show a few of those questions that we'll be discussing, so that way you can, if you want to go ahead and share some pressing thoughts related to those questions in the chat, feel free. And then we'll take a break, and then we'll come back and discuss those. So here are the questions that we'll be chatting about in the second half of our summit today. So based on the data presentation you heard, what resources are available for families in Parker County related to healthy lifestyle? And then based on the children or families your organization serves, what types of community resources do families need the most? And are there collaboration opportunities for providing or sharing those resources? And then the last question that we have is, what other organization needs to be at the table to improve children's health in our community? So I encourage you again to just give these some thought. I know that Blair's had a lot of information and data, but if anything stuck out to you that you feel like sharing now, or if you want to wait until we get to that discussion, feel free. But I'll go ahead and lead us into a break, and we'll plan on coming back around 10:35, 10:36.
How do you improve the health of 1.2 million children spread across 8 counties? Well, it takes a lot of planning, a lot of collaboration, and it takes a lot of support from people like you. Every 3 years, the Center for Children's Health pulls together important data from the public through the Cook Children's Community Health Needs Assessment. That information helps us to build strategies to meet our region's most pressing needs through our programs and through our coalitions and community partners. We then work diligently to track our success. Are we all moving the needle like we want? Are we making a difference? This work is bold and big. Change at the community level often takes decades to fully integrate, but progress is being made daily through all our dedicated partners working together. We report on our progress annually to the government, state and federal, as well as to Cook Children's leadership and other internal departments. We also celebrate this progress with our collaborative partners and build on the collective wisdom our shared experience provides. Although we've always used data to drive our work, our first formal community health needs assessment in 2009 and the assessments that have followed validate the work we do through our collaborations and programs. Data also guides us on how and where we do our outreach. It's data-driven decision-making so that everyone benefits. As we review the most recent assessment data to create strategies for the next 3 years, we take into consideration what has changed in the communities. Are there changes in available resources? Are there new methods to address the needs? We also rely on our partners who live and work in each community to provide helpful context on key people and organizations to work with, approaches that have been successful, and where there are gaps we might help bridge. A few examples of how we utilize our assessment data include: determine new ways to support equitable access to care for all children, expand parent support educational topics, develop a program to identify and remove asthma triggers in the home, strengthen oral health messaging for pregnant women, promote a healthy lifestyle curriculum, including gardening basics for children. We then recommend revised strategies to Cook Children's leadership. Once approved, we have a roadmap for the work we will lead or support in our communities over the next 3 years. Every year, we coordinate progress reports that outline the incredible work our programs and collaborations are doing to improve the health of the 1.2 million children in our region. Gathering this information from families, leaders, and partners is a fundamental element in our efforts to help each child reach their full potential. The overall process is definitely an investment, one that will serve our community well for decades to come. Thank you for the part you play in improving the lives of children and families. Visit our website to learn more.
I'd like to present Dr. Michelle Parker, the founding doctor of the Chiropractic Place for Mommy and Me. PA, specializing in women and children in Aledo, Texas. She has earned the achievement of being board certified as a diplomat of chiropractic pediatrics, but also an internationally board certified lactation consultant, putting her as the only doctor in the state of Texas with those credentials. She's a survivor of Crohn's, passionate about helping mothers with breastfeeding and guiding families towards healthier eating.
Thank you so much, Dora. It's good to see your face.
Good to see you.
Hi there. Well, good morning, everyone. My name is Dr. Michelle Parker, and I am the Vice Chair of the Healthy Children Coalition for Parker County. And I would like to take a moment to share some highlights of the work the coalition has done in recent years. In 2011, the Healthy Children Coalition for Parker County formed in response to the first CHAPS survey results. And in a nutshell, the coalition works to increase community awareness about childhood obesity and to promote healthy family lifestyles. Our vision is Parker County, where families choose healthy and active lives. The main strategies we employ to carry out that vision are engage Parker County for the community to improve children's health, provide and support healthy living education for Parker County children and families, collaborate with Parker County community leaders, schools, and service organizations to promote healthy living for Parker County children, and monitor children's health issues to build healthy generations in Parker County. Next, we're going to talk about the 5210 education, which we absolutely love here at the Chiropractic Place. One major focus of the coalition is to support healthy lifestyle practices that evidence has shown to reduce the risk of childhood obesity. And we do this by offering 5210 education to the children of Parker County. Our coalition developed our 4 sessions of the 5210 initiative using 2 national evidence-based programs, 5210 and CATCH, which stands for Coordinated Approach to Child Health. The 5210 is an evidence-based program that encourages children to have 5 fruits and vegetables a day, no more than 2 hours of screen time, 1 hour of physical activity, and 0 sugary beverages. We combined the basics of the curriculum from both programs and worked with children life specialists to tailor it to our 3rd and 4th grade audiences. Due to COVID, we worked together to adapt the existing 5210 curriculum by adding 15-minute lessons to our current offerings and virtually trained facilitators, all to ensure children continue to receive healthy lifestyle messaging. We also worked hard to add sleep to the 5210 curriculum and updated the program name from 5210 to 5210 Plus. I'm so excited to pilot the new curriculum this year. And since the inception of 5210, the Healthy Children Coalition for Parker County has provided 115 hours of education to over 6,500 children about 5210 and healthy lifestyles. Next, we're going to talk about gardens, which is one of my favorite things too. As a hands-on approach to teach wellness and healthy eating habits, we have partnered with a few schools to help provide supplies for gardens. Now, these gardens include vegetable plants, fruit plants, trees, garden hoses, wood, nails for raised beds, dirt, and much more. And there are many benefits to school gardens, which include healthy lifestyle, academic achievement, environmental stewardship. And gardens are a great way to get children to learn about nutrition while also, staying on my script here, being physically active. Children who are familiar with growing their own food tend to eat more fruits and veggies and are more inclined to continue healthy eating habits through adulthood. Gardening also encourages children to spend more time outdoors and less on screen time. To date, we have helped provide garden supplies to McCall Elementary in Aledo, Austin Elementary in Weatherford, Montessori University, which is a preschool, and then Growing Minds Preschool, both located in Weatherford. And then there's also Agnes Community Association in Springtown. Turning now to our efforts to engage the community and increase awareness about healthy lifestyles for children and families, the coalition adopts a number of strategies. Since the coalition's inception, we have distributed over 56,000 nutrition and physical activity improvement tools and educational resources. This includes education on healthy food choices, physical activity tools, and other evidence-based information to promote healthy lifestyles. Coalition members also support our partner organizations and events throughout the year, such as Center for Hope, Swim Lesson People, MHMR, Help Me Grow North Texas, Aledo ISD, Agnes Community Association, Texas AgriLife Extension Service in Parker County, Texas DSHS, Aledo Advocates, and Willow Park Palooza. Now, April is National Guarding Month, and the coalition has made a special effort to increase community awareness regarding the health and educational benefits of gardening for children. With the support of our members and community partners, gardening and 5210 plus classes will be offered by the Agnes Community Association in Springtown, and free garden kits will be distributed during community events such as April Pools Day and Wild Park Kid Palooza. Children gardening books will also be distributed too. Now, to keep on your calendar too, September is Childhood Obesity Awareness Month. And so to bring awareness to the month and importance of living a healthy lifestyle, we have partnered with area organizations to create a social media campaign and offered a free community workout. And finally, the coalition celebrated its 10-year anniversary last year. This is a huge milestone and speaks to the dedication and commitment to Parker County community has to improve children's health. These accomplishments would not be possible without the wisdom, resiliency, and support of the members, leadership, and partners like yourself of Healthy Children Coalition for Parker County. Please join me in thanking them for all that they have accomplished. We are absolutely grateful for all the work these individuals have done, and every so often we get the opportunity to recognize one of those members for their hard work and dedication to improving children's health. So at this time, I'd like to turn it over to Courtney Bernard, and she's going to do just that.
Absolutely. Thank you, Dr. Parker. Hopefully you all can hear me now. So yes, as she mentioned, periodically the Center for Children's Health will give special recognition to community partners who have just gone above and beyond the call of action. And today we're going to do just that with our Green Crystal Award. And this is an award that the center gives to healthcare heroes who have performed outstanding work on behalf of the coalition in advancing the objectives of Healthy Children 2030. And in the case of this specific coalition, we were looking at nominees who have assisted our 5210 plus program and those gardens that Dr. Parker mentioned to where they would not have moved forward or been implemented without this person or organization's leadership or partnership. And so in Parker County, we believe that the Center for Hope is deserving of this recognition. And so Stacy Marquardt is here to accept that award on their behalf, but we've also worked with Linda Leal in the past, who has since retired, and now Hannah Siebert as well. So many people from that organization have worked with the coalition over the years. I'd like to highlight a couple of contributions that Center of Hope has made that we just are so appreciative of. You heard Dr. Parker mention the microgreen project and those little gardens that they do. And we were able to pilot those lessons with the support from Center of Hope, where they recruited Camp Hope students to participate in those lessons and provided a closed group on their Facebook page to do that, where the students could watch live in the recorded lessons and share their own photos of themselves growing the microgreens and connect with the junior master gardener who was teaching the lessons. Camp Hope leaders have also incorporated the 5210 curriculum into their existing Camp Hope activities through the summer. So they had their healthy snack activities that they were already offering their Camp Hope participants, and they added virtually the 5210 education to the volunteer training and to that time with those children and families, so that students coming for virtual Camp Hope could receive that education as well. And we've heard a couple people mention already how the community has come together in the face of the pandemic. And Center of Hope has been a key player in all of that, providing COVID support. So offering fun activities in their food pantry for children and families, so that the kids had some supportive tip sheets for children and parents to help cope with the pandemic, as well as all kinds of activities like jump ropes and coloring books to help the kids pass the time when the schools were shut down at the beginning of the pandemic. And then, as I mentioned earlier, Center of Hope has just been a long-standing partner of the coalition since 2010. They've been an active member and supporter, hosting coalition meetings at their building when we were in person, and working on the different collaborative efforts and with the coalition members, addressing food insecurity, offering parent and gardening classes. So just overall, a huge resource for the community, a huge resource for the coalition, and we're so grateful to get to work with them. And because of that, it's a great honor to present the Green Crystal Award to the Center of Hope. And Stacy, before I turn it over to you to say a few words, I'd like to see if our coalition coordinator, Dora, or Dr. Parker as our vice chair have a few words to share.
Thank you, Courtney. So the Center of Hope's enthusiasm and passion to support the Healthy Children Coalition for Parker County and improving children's health through promoting healthy lifestyles made them an ideal community partner to nominate for the Green Crystal Award. During the unprecedented time of the pandemic, the Center of Hope was not only in the front line supporting the community's basic needs, but they also worked hard to continue their important work with children and families in the community. And it's through their work of trying to bring a normal summer to the children of Parker County. They eagerly and creatively collaborated with the coalition to make sure that the kids had the important information about living healthy lifestyles, and they are always listening to the community, and that's why I look forward to our continued work together in serving Parker County families. So it was an easy choice for me to nominate them for the Green Crystal Award.
Dr. Parker, anything to add?
Are you able to see me? I guess I can't. Oh, no, it's not showing video, but definitely Camp Hope has just been, or excuse me, Center of Hope is just absolutely amazing. And then all the resources they do with Camp Hope during the summer. Not only have we known personal families that have benefited from all their efforts, we definitely know all the women's and men's hearts there. They are definitely very deserving of the Green Crystal Award.
Wonderful, wonderful. Thank you both. And Stacy, I know you're on the call. Hannah, I saw you were on the Zoom as well today. We're just so grateful to all of you at the Center for Hope. So we're glad you're here today with us. Would you like to say anything while we're together?
Sure, yes. Well, thank you so much for the honor. I get to accept the honor, but it's really the staff and the over 300 volunteers that work on Camp Hope that are making it happen. So we are honored to be recognized like this. And the partnership has really just been so beneficial for us. It's really defined how we work with children, especially with our Camp Hope program. We're able to work one-on-one with kids, focusing on healthy eating and education for proper nutrition and healthy lifestyles. And it's really the resources and the support that we receive from the Healthy Children's Coalition, along with the Center for Children's Health. So it's really kind of a collective group of people that can make this happen to improve the just the wellness of children in our community. So thank y'all so much.
Wonderful, thank you. And I think just everything we've heard about Center of Hope is a really great segue to the last portion of our agenda today, and that is a discussion with everybody here about the resources that are available in Parker County and how we can continue working together to improve children's health. So you heard Lauren tee up some of the discussion questions before the break. So they're on your screen here, and we're going to launch a poll right now. So we'll get the tech going for that because we want to hear from you all. So you'll see a poll pop up on your screen asking you to answer our first discussion questions. And we want to know, based off of the data you just heard, what resources are available for families in Parker County related to healthy lifestyles. And we had a couple options in there, but feel free to choose other as well. And if you don't see your option there and want to choose other, you can add it to the chat. But to start us off, I know we've already heard from Shaylee in the chat box during the break, who was and Judge Dean talking about the med pods as a great resource getting that access to medical care to kids. But what else is out there? And while we answer the poll, I'll also turn it to Blair and Lauren and Dora from the center to share a few words while we wait for folks to answer the poll.
I'm enjoying watching the results. Not everyone
we
can
get a
see
sneak
it,
peek.
but I'm getting a sneak peek. I'm kind of waiting to say anything before I connect some of what I'm seeing with some of the data. But I'm really interested in those. Was it MedPods and how that helps get children access to care because that well child visit is so important, not only to child's healthy lifestyles, making sure that their BMI is normal and within normal ranges, but also helping families with social services if they need it. So if they need, food or support in the home, any kind of anticipatory guidance on safety in the home, that is such a great touch point for everything that we've mentioned. And just the community collaborations that I've heard just right now is just so powerful, and it's such a protective factor for children in Parker County.
Mm-hmm. And I think one of the things as far as getting the information out to the community from the different opportunities that exist. So like looking at, our partners, our faith-based organizations, our, businesses, basically where people are learning, working, playing. Members of the community help, distribute the information about these resources and empower the families to reach out to these resources. So it takes everybody working together.
It sure does. And Shaylee, Miss Shaylee, I'm gonna call you out if you're still on the call. I might ask you to unmute here, but you had some really great comments in the chat box during the break where you talked about the med pods and then the community coming together to work together on these things. Do you have anything you'd like to add to this, or the importance of that access to a medical home or care while the kids are in school?
Hi, everyone. I'm here with my team at the ESC. We're working on the nursing grant and the TESHI grant, which is Teens and Families Experiencing Homelessness. And so we work at the regional level, and we are so excited to be able to work with the communities and bring community resources together. And so if any one of you who are providing community resources need any help connecting resources together, or there's any way we can support you, we are so excited to be able to do that. So please feel free to reach out to us. I'll put our website and my contact information in the chat box. But I have worked with Parker County for 5 years, and I've worked very closely with Judge Dean's office, with Cynthia, with Parker County Hospital District, and many of the superintendents. And I am really proud of what Parker County does to support student health and just the health of our families in general. I think that having worked at the regional level and seeing some of the things that are in place in other counties, I think that Parker County just takes that extra step above and beyond and puts the health and welfare of students at a very high priority. And I think it's really important to point that out, that, that Parker County really does take the health and wellness of students and kids very seriously. I'm really proud of what they do.
Thank you so much. That's wonderful. Yes, please, everyone should connect with Shaylee. She's done incredible things in with the school district and in the county. I had the pleasure of taking a tour of her med pods and how she's worked to set it up, her and Cynthia, and it's just absolutely incredible. So that's a wonderful resource. Before we move on to the second poll question, I've got the poll results highlighted here. That we just wanted to point out. And so you all, of course, mentioned that Parker County has a lot of outdoor areas and walking trails throughout the county. It sure does, for families to access and nutritious food as well. So if anyone would like to put some of those resources they know about or that they support in the chat box, feel free to do so, and then y'all can connect with each other outside of the summit. So I'll now launch our second poll question. You'll see that show up on your screen. And this time we're kind of continuing the conversation we've already having, but based on the children and families that your organization serves, what kinds of resources from the community do you find that families need the most? And we've heard from Blair in her data presentation about some of the most common responses. Blair, do you mind recapping some of that?
Yes. So food, access to nutritious foods, or even nearby stores that have fresh fruits and vegetables, that was something that was a community health need identified, not only in Parker County, but in the surrounding counties as well. Parent coping information, that is another huge community health need, not only for parents of children that are older, that 12 to 17 age group, but parents that are single caregivers. If they don't have emotional support, they also need some additional support or protective factors in the community so that they have the support they need to parent without much stress. The other thing I'd mentioned, I don't know if I mentioned it in my presentation, but a lot of this data, it's really powerful because it's local level and it's as closest to real time as we can get. So I've heard some really great resources or ideas or collaboration, and even in the chat. But if there's an opportunity where you're writing a grant and you want to work towards this and you think our data could be helpful, please reach out to our team because we have that data available and can share that.
That's great. Thank you, Blair. I did see, again, you guys are so participatory in the chat, because I also saw from Madeline with Pecan Valley talking about the System of Care grant that she has, and then Ashley from Millwood and Excel responding, but again, talking about all the ways the organizations can come together to support families around their mental health and coping skills and resiliency. And so if I'm sharing the poll results here from what you all said, and so family resiliency and parent coping information made the list here, in addition to the most pressing need that you all see, and that's access to basic needs like housing and food and utilities that every family needs. But I'm wondering, Madeline, if you're still on the call, if I might ask you to unmute And if you have anything to share about the work you guys are doing for that system of care grants or some of the needs that you see for families.
Yes, hi, thank you. My name is Madeline Cano, and I just recently was invited to lead this initiative through Pecan Valley. It's a new grant to continue to expand the system of care, which pulls together all resources in each of our communities to work together and find solutions to some of these gaps. So it's a 4-year grant. We're just getting started. So we're collecting our data and trying to find out where we're needed, what the needs are in each of our 6 communities. We do have some positions open in our grant also for a school-based case manager and a school-based therapist. Those are listed on our website if anyone's interested or knows anyone. As we continue to expand our team. Our focus is going to be on providing for the mental health of school-age children and just building a system and support network, utilizing existing coalitions, existing groups, or pulling everyone together and saying, okay, what's working? Let's further support that, and what isn't working, and let's find a solution and all work together to get that solution implemented over the next 4 years, so that by the end of this grant funded program, we have something in place that can continue to be in each of our communities. So we're excited to get connected with the leaders and participants in Parker County that are interested in serving children, which everyone on this call is, and finding out what we can do together. So we're still in an information gathering stage, but we're excited to be here. Thank you so much.
Wonderful. Thank you, Madeline. And I'm seeing some really great things coming through in the chat. And that kind of brings me to our next question that's just open for discussion in the chat. But what other collaboration opportunities are out there in Parker County to provide or share these resources? And you guys are already hitting on that, seeing from Leslie, looking at providing laundry funds and supplies for students experiencing homelessness. So again, touching on those basic needs. What else is going on out there in the community? But do please feel free to unmute and share with the group if you have other resources or collaboration forums that you participate in or lead or know of.
This is Susan Bone. I'm the superintendent in Aledo ISD. And I appreciate Madeline talking about the grant that they're working on, and they're looking for school-based mental health professionals. I perceive that to be our greatest need. And what I would like to do, where we're located in Aledo, we're kind of in a desert for mental health professionals. And so it's just not very convenient to take your child to see a mental health professional. And of course, we all know that there's a shortage of those folks right now anyway. And some of them don't even take insurance. Like, you just have to pay cash. You just have to be somebody who has money to pay cash. So I'm very interested in anyone in the county who is currently using school space to provide mental health care directly to kids, either right after school or even during the school day. And that's more than what our intervention counselors have the capacity to do, and is more intensive. We have partnered with an outside organization out of Fort Worth, but would love to figure out a way to make that happen. And I don't think it's necessarily unpaid or a free resource for parents, but would love to be able to do that, to give our space up so that kids can just stay on campus and get what they need for mental health services and not have to miss school.
Mm-hmm. Thank you. Thank you for sharing that. Yes, the access is a huge deal. And I saw that mentioned in the chat by someone earlier in the program as well. And especially in a community, we say Parker County, we know that's multiple communities in one, but things are spread out or clustered in certain areas. And so it does make it difficult when families have to go somewhere to get those resources. I saw in the chat that Karen from AgriLife sharing about some of the programs that they offer. Karen, would you like to say anything about that, or how you serve families and how others can partner with you?
Yes. So I work with the Master Gardeners, which is also part of AgriLife. And I work with the Junior Master Gardener part of it. But I know that, and even though I've never participated in any of the cooking classes or anything, I've always heard that they have different classes out there for parents, and they can bring their kids too. But for parents, I think it's a real good outreach, kind of what y'all are looking for, to teach parents about cooking and the nutrition and things like that. So there's other people that work there that do those classes. I'm just not part of it. I just heard about it though, since I'm working through Master Gardeners.
That's great. Thank you. And that's exactly how the word gets around, is by sharing what you know of and what you're involved in or hear about from others. And looking through the chat, I also saw a chat box from Leanna with MHMR talking about the family coaching program. Leanna, would you like to share more about that?
Yes, ma'am, I'd love to. So the Family Support Coaching Program is a grant-funded program, and it does cover Parker County, and it is free to our families. They enroll and they get services for 6 months. We help with doing developmental screeners, connecting to resources, mental health consults, as well as that parent education and support, which I know that was kind of one of the big things we touched on. A lot of parents just don't know how to manage right now. And so that's something that the coach gets to kind of come alongside and do with the family. There are some parent education courses to help with children who have experienced trauma, which really all of us have after living through this pandemic, but we can come either in the home, or we also are doing virtual services. So we're available to more families right now, and we've been connecting to lots of resources, and we just received some grant funding also to help with emergency funds to pay for utilities, rent, food for families. So if families in our program, they can get that financial assistance pretty quickly, actually, once they're enrolled. So a lot of great things going on. And Mika may want to jump on. She also works for MHMR, but we've got that community resource center opening on Thursday in Springtown. And we're very excited about having kind of a central hub out there where families can come and get connected to resources. And we can also meet families to do services. If, you know, the home is not a good location for them and virtual is not good, we've got this resource center.
I don't really have very much more to say, Leanne. Hi, I'm Mika Brock. Leanna she covered it really well, but I do want to add one thing. And that is that our new Springtown Resource Center, we're going to be having groups out there. We have like kinder music, we have parent education, nurturing parenting program, which is a parenting program. We cater mostly to 0 to 6-year-olds, but we also have like parent cafes that are possible to be out there. We have what's called Wow Talk available, which is for teenagers to come. And it's just getting and looking to see what the needs are in that area and what our families want. So on Thursday, we're going to be having applications for parent involvement. So we would like to have like a parent coalition to come in and be part of this so that we can get their input also from it. So there's a question, email me.
Yes, and I think you put that in the chat for everyone, right? With the upcoming event, I believe. But yes, please do. This is fantastic. You all are sharing so many wonderful resources already available to children and families, and hopefully everyone is already aware of these things out there for the families they serve, so that families can get connected. To kind of wrap up our conversation today, I'll pose one last question, and feel free to either unmute or put it in the chat. But who else in the community needs to be at the table to continue improving children's health in Parker County? We know it takes folks from all across the community, and we've heard from schools and public health, in the medical side of things, social services, mental health. Who else needs to be involved? And that can be a specific organization or a general group that you know of.
I think so. One of the things that I would like to see more of is getting more family organizations, like PTOs and PTAs involved, really connecting with the families who we're reaching out to, so that we can, meet them where they're at, and have them guide us as far as like our approach, so that we can have a broader reach in the community. I think families have a strong voice they can share.
That's wonderful. And that ties into Madeline's comment here about communities and schools. And so I'm not familiar with what schools, communities and schools is in the Parker County area. But again, a huge resource for dropout prevention and just getting those kids connected with all of the resources they need to do well. And then Kim Brown is also sharing about Mind Above Matter, how they can come to the schools to provide services. So again, addressing that access issue. Any last thoughts from anyone? Well, with that, I'll thank you all here, and I'm going to turn it over to Lauren to close us out for today. But I appreciate you all interacting with us and hearing from you all about all the different things happening in Parker County and available to families to support kids. So thank you.
Thanks, Courtney. And yeah, again, thank you all for sharing your thoughts and questions. I really loved how you guys were able to make those connections, and hopefully there's some follow-up that comes from that, and we can start doing even more great things in Parker County. We'd like to pause just in the spirit of continuous improvement here, and ask that you all please scan the QR code, or there's going to be a link, Rashida just provided it, and then chat that you can click on to take a very brief survey about today's event, and it'll be helped. We'll use this information to plan our future events. So we'll pause here for just a few minutes while you all do that, and then I'll close this out. All right. So thank you all for your continued support of the Center for Children's Health and the Healthy Children Coalition for Parker County. You all play such an important role in improving the health of Parker County children every day. You can find more information related to the Center for Children's Health and the Coalition and data resources on our webpage. And you can also contact Dora Garcia. Her email is there on the slide to learn how to get involved with the coalition. And then Blair kind of talked about this earlier, and the link was shared earlier in the chat. But don't forget about the data dashboard that was shared earlier. It's available to the public and contains really great information related to children's health in our region and those in Parker County. If you have any specific questions about today's presentation, please feel free to email chnafeedback@kirkchildrens.org. And again, thank you for spending your time with us today at our Parker County Child Health Summit. Hope you all have a great afternoon.